Hi everyone. Good morning. My name is Rodrigo. I'm the CEO and founder of Orgavalue, and today I'm excited to share with you a groundbreaking solution that has the potential to transform the field of organ transplantation, following our mission to eliminate the organ transplant waiting list. So, as we speak here, the World Health Organization estimates that 90% of the global need for organ transplantation it's not being met, which means that every day 40 people die each day just waiting for an organ. In our case, a liver match, and 54% will develop a disease related to cancer, to transplantation methods that have significant drawbacks, including high rates of post-transplantation disease and the need for a retransplantation with just in 5 years. So, our solution at Orgavalue, since our mission is clear to eliminate organ transplant list, it's bioengineer new personalized human organs. So we start to think how we can recycle organs from donors or cadavers that are available in the hospitals and take these organs into a new step. So basically, we follow the HENDA law from Portugal and some countries in Europe that help us to post-mortem donation of these organs. So as you see here, we saw the video of our technology that we utilize a novel process that involving the tissue decellularization and recellularization that involves a safely washing away from the cells from these organs, creating a scaffold without cells in order to be future recellularized and repopulated with new cells from the patient and personalize a human organ. So our process already was validated in an ex vivo model from the heart and lung, and our main focus, the liver. So at this video, we can see then the recellularization process where we collect cells from the patient. In this case, the patient that needed this organ. We differentiate and multiplicate in the lab in our bioreactors. And then during 2 to 5 months, we can have a fully transplantable personalized human organ. So at this moment, we are in the preclinical validation with the key partners from the national and international institution, and also most important with our hospital, where we already achieved the EMA scientific advice in this year, looking to through next year for the phase 1 of clinical trials, and again from the EMA scientific advice, our second milestone. Then we have, of course, we are a technology that is acceleration of clinical development, since our technology it's very in need and has a fitness for the part of the accelerating of the clinical development. So our market, it's a market of 120 billion for all the organ bioengineering, but our focus in the addressable market in Europe, it's 2.8 billion with a need of 60,000 patients in Europe. So our business model, it's very basic. We collect and disruptive. We collect organs from the hospitals, and then we apply our solution that is several reagents, low cost and very differentiated, with a machine that has an Orgavalue cost of 50,000, and of course a price based on our market of 280K per unit of the organ. So if you compare from the conventional ones to ours, the conventional therapy from liver transplantation can go to 60,000 to 1 million, where with Orgavalue and takes several years until death. From these steps, we add a lot of money, very risky, and most of the time do not offer the properly solution. So with Orgavalue, we can reduce the short time with more simple way, efficient and rapid for the patient. It takes the price of just 280K, that is a several reduced cost, and takes 2 to 5 months until a new life for the patients. So if you see our competitors, we are the only ones that personalize the human organs for human efficiency, comparing with our main competitor that is Miromatrix, where we have to reduce the price, the safety, comfort, and easy to use because any clinician can do it with a simple task. But Miromatrix at this moment has secured 71.5 million for investors with a valuation of 164 million. So our strategy is start to Portugal and then to go to the spread for another countries in Europe, where we are thinking of funding at this moment of 5 million in pre-seed. Now, the valuation, we have value of 4.93 million euros of Orgavalue with a 50,000 public investment, where we have a net present value and evaluation of our free cash flow equity and average growth that gives a net present value of 5 million. So the team behind it's expert in regenerative medicine, health economics, stem cells, and tissue bioengineering. Thank you so much if you are looking for.
Fabrizio, do you want to go first? Okay, mine it's a very short question. So thank you so much for the presentation. It's always cool to see very ambitious project. My question is more from a bioarchitecture standpoint, which I don't know much, so it's more a curiosity than a real question. So when you do this washout and you are left with the scaffold, how are you sure that everything is staying in place in a way that you can, fill with new cells, and also how you make sure that these new cells in this process of refilling, they rebuild the architecture of the original organs?
Yeah, so to answer you, we already have several tests from the scaffold that is decellularized and then recellularized, and we test in our preclinical validation in pig. At this moment, we have already access to human organs from the Public Ministry and Health Ministry, and we are actually working with them to test exactly if in the end the patient will receive and the cells will be suitable for in terms of biological standards from human. In pig, we already test. But now our focus is in human, so we just want to make the same thing in human, and then we are working with them. But yeah, it's a perfectly fine. It's not delivery. It's not fully recellularized, but does not mean the main issue here. It's for the liver to be fully recellularized with vascular cells and neuronal cells, and the parenchyma does not need to go to 100% of the cells, but 70% of the cells will do the work properly for the biological action that we want.
So a question for me, I'm not an expert in this field, which is very fascinating. And I've seen some companies, and the question is, can you provide a proper supply when it comes to market? I mean, that's maybe one of the most crucial points, right? Because you're not making drugs, you're making organs, so that's pretty relevant.
Yes, the organs come from the patient that are from human cadavers. We can have donors or human cadavers per se, and then of course we can have a stock we have in our institute. At this moment, we have 70 livers in -80, in -150 that is frozen. Then this matrix can be freeze and then to apply to a new patient. So yes, we just need human cadavers, and we don't need to build from scratch for instance, bioprinting. So yes, we have fully stock units to provide to the hospital, or even the hospital by itself can do this collection.
So I can ask a question. So what are the regulatory challenges that you're anticipating within EU and also in the United States?
Can you repeat that? I did not hear.
So I'm asking about the regulatory challenges that you're anticipating in pursuing this route. Thank you.
Okay. Yeah, so the regulatory challenge here, it's a highly risked technology because it's biotech. It's not a drug that is already a plan. So this is a TMP, advanced therapy, medical therapy product, where we work with EMA to transform and to create these clinical trials, because we cannot have a human clinical trial conventional, because we cannot select a cohort of patients, remove the liver or remove a healthy liver and put ours. So at this moment we are working with brain dead patients where we can make an ectopic transplantation from outside of the body and to test our solution. And then we have the regulation of TMPs with them. So we are trying to design a personal study where we to get, of course, the conditional marketing authorization. That is another part from the clinical trials that EMA has add to the conventional one, and we are suitable for this part of the accreditation.